to a question from Reddit now. All right, this one is, I'm experiencing calcium deficiency. It leaves white spots, awful sensitivity, etc. And I'm dealing with it now. But what causes calcium deficiency in your teeth? Is an actual calcium consumption problem, or does it correlate with the fact that I had weak enamel to begin with? Is there something that causes it?
So the question becomes whether the calcium deficiency causes any type of dental problem, right? So a lot of times when you start to see some kind of a white spots on the teeth, when we have patients come in all the time here, and when they start to see some white spot, they immediately start to relate that with calcium deficiency. A lot of times it may not be just the calcium deficiency because you have got some demineralization issue. So it may not be just the calcium, it may be a variety of minerals that you're deficient with. And particularly one of the most common deficiency that we see that causes discoloration of your teeth is the fluoride deficiency. The fluoride deficiency could happen for a variety of reasons, just like this person described it here. It could be a weak enamel to begin with. Yeah, absolutely. The reason that you may have a weak enamel to begin with is because of the fluoride deficiency when you grew up. So I have patients that come see me from areas, for example, like East Texas. We have people that grew up in an area when there was not much of a regulation on the city water fluoridation. I have a lot of people who grew up in Mexico. They come to see me, and I ask them, "Hey, do you know that you grew up in an area the city water was regulated?" As you might know, the city water is not possibly regulated in Mexico. So now they got this big white spots on their teeth. It's because of the lack of fluoride when they grew up. So again, going back to this reader's question, could this be related to a lack of calcium? Not necessarily. It could be a variety of minerals, and particularly the one that we most commonly see is because of the lack of fluoride. So the recommendation here is most of the people who live in the United States, and if you're living within the metropolitan area, most of the city water is absolutely regulated. However, if you're not drinking the city water, and if you're drinking a certain type of water, like either a distilled water or like any type of bottled water, if it is not rich with the fluoride that you need, so then you may see those white spots. And then people who may be drinking the regular water, but they may not be using the fluoride toothpaste they need. They may start to see some white spots. And one of the other most commons that we see is people, they start to use some over-the-counter bleaching products. So they may not be using it properly. And then I see people like, "Oh, hey, doc, I bought this charcoal whitening toothpaste from Amazon or eBay, and can I use this?" Or they say, like, "I started using it, and ever since then I've been noticing this white spot on my teeth. Is that something that's going to go away?" But once you have done some damage sometime, it's just not going to possibly go away. Or even if it does go away, it may take a long period of time before it completely goes away. So make sure that you're going to use an ADA accepted toothpaste or toothpaste with an ADA seal. When you walk down the aisle at the departmental store or your drugstore, you will be able to see some of those toothpaste that are accepted by the ADA, recommended by the ADA. So make sure you're going to use those toothpaste that have enough fluoride, particularly if you're experiencing those white spots. Make sure you're going to use them, and that way you can prevent them from happening before some damage happens on your teeth.